There were some corrections that needed to be done, some caveats that they added into the papers around the side effects issue. So I carried on this campaign. I carried on publishing in other journals, kept talking about transparent communication, ethical evidence-based medicine, statin over prescription. There are other things we can be doing in terms of lifestyle, right, which are going to be more powerful, whether it's low-carb Mediterranean diet, exercise. Why are we not focusing our attention there rather than just giving people all these pills that they think is going to protect them from heart attacks, and in most cases it doesn't. And in that journey, and this went on for a few years, this is where things got really interesting. So there was, to answer your question, yes, there was a lot of backlash. It was tough. There was a bit of smearing going on. But I realized then, as a public health advocate, that you've got to have a thick skin and grow a rhinoceros hide. And those are the words from a man called Simon Chapman. Simon Chapman is a professor of psychology in Australia. He was considered the lead campaigner in making sure there was tobacco control in Australia. And he wrote a paper talking about his 38-year career in public health advocacy and gave 10 lessons. And one of those lessons is this: as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. So grow a rhinoceros hide. And I thought, you know what, I'm up for it. I'm up for it. So many more people came out of the woodwork to support me. Other doctors said, you're right. And I thought this is about truth and transparency and about ethical medicine and highlighting all the corruption and the conflicts of interest. One of the things that Professor Collins hadn't been made apparent is his department had taken over £200 million at Oxford for doing research into statins from the drug industry, and they also kept the data commercially confidential. So most of the publications and guidelines that were coming on statins were emanating from that department, where no one had been able to independently verify the data. And he is quoted in The Guardian saying, only problematic side effects from statins affect 1 in 10,000 people. So I thought this doesn't add up. I think these are biases, conflicts of interest. I'm not saying that he was deliberately malicious, but I think there's a huge, conflict of interest there that is clouding his judgment. Plus, he's not a clinician; he doesn't see patients. So there's all of those things that I think limit his ability to really look at the evidence properly.